So again, for those of you joining us, welcome. We have a poll right now up, an estimated 10% reduction in contraceptive use due to the pandemic-related challenges on the provision of core services in low and middle income countries would result in an additional X million unintended pregnancies. So if you want to go ahead and take a guess at that, and we will be sharing the answer later on in this session. Great, if you want to go ahead and bring up the next poll. All right, great. So one more poll. Rising malnutrition is expected as X million children will miss out on school meals as a reliable source of daily nutrition. Get a few more seconds on this one, and then we'll go ahead and jump into introducing our speakers. All right, let's go ahead and I would love to welcome our speakers who will be giving a 10-minute presentation on putting the voices of those most affected at the center of the COVID-19 response. So please welcome Dr. Aparajita Gogoi from the Center for Catalyzing Changes, based in India, and Maya Rodriguez Reyes, a youth leader for International Planned Parenthood. Dr. Gogoi, would you like to begin?
Yes, thank you, Barbara, and welcome everyone. I know that there's been a little bit of figuring out which rooms to join, but welcome. And I will start sharing my screen, and then I hope that I'm able to do that. Just give me 1 second.
It's a whole new world with technology, isn't it, everyone?
Barbara, can you share my screen? Is that possible?
Sure, let me bring up. Caroline, do you happen to have that handy?
Yes, 1 second.
I got it. Thank you, everybody.
Oh, great.
And sorry about this.
There we go.
All right. So welcome again, everyone. And I am thankful that you are in this group because there's been a lot of competition. There are many groups all over. But I would really, want to begin by sharing with you that for all of us from all over the world, this pandemic, this subsequent lockdown, and the ensuing events which are still unfolding has been life-changing. We have felt the impact on livelihoods, on food security, on mental health, on domestic violence, on safety, security, autonomy, decision-making, sexual and reproductive health, access to information, products, services, so many things. And all of these are affecting the lives of children, women, men, and young people. And I think we have seen a lot of stuff on the media, which are profoundly devastating. But I really wanted to start by sharing this picture of a 15-year-old girl called Jyoti, who cycled for 1,200 kilometers, that's over 750 miles in sweltering heat to get her father home during the lockdown. Now, this is a story which shows enormous grit, courage, resilience, but we can only imagine what must have been her compelling reasons to do so. So in order to really understand the lived realities, AMREF, Pro Familia, the Center for Catalyzing Change, and the PMNCH, over the last few weeks, we have put together the lived experiences from 3 different continents, more than 12 countries. We know what we share with you today, these realities are really universal. The context may change, but the underlying theme remains the same. So I'm leaving in your mind the picture of Jyoti, and I'll go ahead and share with you some of what we have heard from various people. So I'm just going to share very few, maybe 4 or 5 of what we have heard from people on the ground. The first one is that, we've all seen how sexual and reproductive health services have really been impacted. This is a quote from an implementer who talks about the fact that most expected women are not visiting hospitals for childbirth for fear of curfew, fear of contracting COVID-19, or being put in quarantine. And this has led women to seek unskilled care. And when complications occur, for example, when excessive bleeding takes place, such women and children can lose their lives. So this is an example of the impact that we can see on sexual and reproductive health. Food security, I think beyond, like I said, health, a lot of families have been severely impacted because of loss of livelihood. And this is a quote from a very young person who talks about, eggs were not lacking at home, but we had to stop buying them. There are days when there is not much to eat. So my brother is the priority because he's the smallest. Coming to education, I think all of us know the closure of schools and the profound impact it is having and will have on young people. This is a quote from a very young adolescent girl who says, "I can't go to school at all, and I feel that my life is just on standstill. Nothing is moving. I may never finish high school. Who knows?" All of us have heard about how gender violence have kind of increased. There are many different manifestations of gender-based violence, but I've picked up an example, a quote from Child Marriage, where a gender advisor to a ministry tells us that many families have turned to marrying off their daughters, their adolescent daughters, in a bid to stave off hunger and homelessness. I think this is tragic, right? Again, security, multiple manifestation, but this is a quote from a pregnant woman who talks about what will she do when she goes into labor at night. The police are so brutal, and I'm afraid that I might be beaten up for disobeying curfew times. About livelihoods, the multiple examples, but what I have for you here is how it impacts the whole family. So this girl tells us that my father's job is on hold, my mother's job, my brother's job, we haven't got our salaries, and we don't know when we are going to get paid, when we will get our jobs back. So these are just some vignettes of reflections that we have in the lived reality report. But I also want to move on to talking about, what has worked. What have we seen that is working, right?
1 minute left.
Yeah, so we know that there are many problems, but we have seen from evidence on the ground that immediate economic relief has worked, be it direct cash transfers, food stamps, subsidies, schemes for those who have lost their livelihoods, etc. We've also seen that when we talk of mental and psychosocial services, we have seen that there are some examples of telephones and online platforms that have worked, but we must remember that a lot of our population do not have access to digital means. So what do we do for them? There are some wonderful examples also coming out from how people are dealing with intra-household stress and violence, how they're bringing the family together, how they're redistributing and defining responsibilities. A fourth what work example that I want to share is how local representatives, NGOs, field level workers, women's groups have really mobilized, not just to talk of COVID prevention, but also rebooting livelihoods on the ground. And I also want to talk about the What Women Want campaign, which is a fantastic example of how 1.2 million people were mobilized, their voices were heard, and then now we are trying our best to ensure that their demands are met. And I want to really end by sharing with you just some priorities which I want to put out there. You will, in the group out session, come up with many more priorities, but I thought that I'll just put this here to spark the conversation. So my first recommendation is that all COVID-19 respond and rebuild plans must consider both the direct and indirect impact on health and well-being of women, children, and young people. And this must also be done through data-driven rationalization of services to ensure that vulnerable populations are not left behind. I also feel that we have heard that most countries have put out the list of essential services. We must push that protective services for women, young people, and children must be classified as essential. And we need to invest in strengthening hotlines, safe spaces, referral pathways, and other justice mechanisms that exist. And I think there is an urgent need to advocate for increased attention to mental health needs of all people from all walks of life. And I want to end before I hand it to Maya, that I think this is time now that we should institute very transparent functional mechanisms where women's and children and young people's self-articulated needs, let them decide what they want instead of all the time other people deciding for them. So how do we get their self-articulated needs routinely captured, and how do we use them to really not just kind of decide our policies and program priorities, but also monitor. Thank you, and over to you, Maya.
Thank you. Hi, everyone. Thank you for joining us today. I am glad that you are here and that you have chosen this particular breakout to be able to speak with us and to, as Aparajita said earlier, to talk about what should be done and what can be done within this COVID-19 response and any other crisis that may come our way, that will probably come our way as well. I think that COVID-19 has affected all of us in diverse matters, how lockdowns and quarantines all over the world have affected us. But I think there's always a few people, and it's more than a few, it's thousands and thousands and millions of people that are particularly affected by lockdowns and by quarantines, particularly people whose homes are not necessarily safe spaces. I want to share with you an experience that was collected by a survey in Latin America, directed by PPF, where an anonymous person shared her experience. She is a trans woman who has left her home a long time ago to study, so she moved into the campus. And because of COVID-19 and because of the lack of access and classes being imparted from a distance, she had to go back home because she didn't have the resources to be able to cost and to acquire a stable Wi-Fi service. So she has to go back home where she is not accepted as who she is, where she has to become another person, where she has to go back in time where she wasn't accepted and has to go back to a very violent state in her home where she cannot be herself. And right now she is practically quarantined within her own bedroom. She is isolated from her family because the violent conditions within her home have become too vivid and too incredible for her to live a constant life. And because of that, she physically has become someone else. Her hormone treatments were stopped because of COVID-19. That wasn't a priority in surviving this crisis. And I think, like her, there are thousands and thousands of people all over the world, and not only her case, and not only cases like her for trans communities and queer communities, but also a lot of diverse areas of vulnerable populations who have been impacted directly and are continually being impacted by COVID-19 and the diverse governments, or any areas of power that have been providing services. Young women are an incredible increase in work within their homes. They're losing their jobs that were already precarious, jobs that were already a minimum wage, are being incredibly violated and incredibly hurt within these new conditions of working, which means that there is an incredible increase in violence within all over the world. LGBTQA communities are historically lived in unstable houses, in unstable and insecure households, which is why many queer people, we have created communities outside of our homes. We have created safe spaces outside of our homes, and we have created families outside of our homes. And right now, those families aren't particularly accessible to us in this areas, which means there's an incredible increase, and the survey has demonstrated that there's an incredible increase in queerphobia, in homophobia, in transphobia, and lesbophobia, which means that our thousands and thousands of millions of people who are constantly in a state of violence and constantly in a fight for their lives, other than to fight against COVID-19. With this said, there is a general increase in gender-based violence. There is an incredible increase in queerphobia, an increase in domestic violence, and all these violences that the state doesn't necessarily see as prioritizing when it comes to COVID-19 response or a crisis response. As I said before, homes are not necessarily a safe space for many of us, and that is demonstrated in education at a distance. It is demonstrated in a lack of access to health services, and particularly a lack of access to justice for gender-based violence or any other violences. The few areas that the government has provided for gender-based violence are not working or are stuck, or sometimes they're not even as mediocre as they were before, at least in my experience here in Puerto Rico. And I think having said this, I want to show, and I want to talk about to finish three areas that I think what should be done. I think these are three aspects that many feminists and organizations have talked about within what should be an adequate response to COVID-19, an adequate response to crises in diverse areas. First, gender-based emergency plans, which take into considerations women's states, LGBTQI states, and how they are affected within crisis and within their homes, and what are prioritizing to us as well. A decentralization of economic support and services so that community-based organizations and NGOs can properly manage the needs of their communities, because they're the ones who actually know their communities. And third, a widespread prioritization to vulnerable populations when it comes to services, economic support, any other aspect that is a main concern due to COVID-19 and main concern to diverse crises. And I think now that when we move to speak of another areas, I think we can partly speak of these three areas and how these three areas can actually change how we see COVID-19 and change how we are expected to treat within crises in diverse communities.
Thank you so much, Maya. What we're going to do now is put all of you into mini breakouts. And these are going to be self-facilitated mini breakouts. So you'll get 7 minutes to talk amongst yourselves, and this will be randomized. And what we'd like you guys to do is considering the challenges that you've just heard presented, what are some of the solutions that you have seen work within your communities? So what is being done well? Again, we're going to put you out into mini breakouts, and without a facilitator, please introduce yourself, discuss this question, and then we will bring you back in about 7 minutes. Again, you will need to unmute yourself when you go into your mini breakouts. All right, we'll see you soon. Thank you. Welcome back, everyone. We're going to go ahead and get started with a discussion. If you would like to use the chat function within Zoom in order to comment on what you thought was thought-provoking or jumped out at you during that conversation, as well as adding any questions that you may have for Aparajita and Maya, that will be great. We will be monitoring those chats, and I will be forwarding those questions to our presenters. And before we gather some of that information, I'd like to kick it off. What challenges were you not able to address during your presentations? Share a little bit more with us. Either Aparajita or Maya?
I think due to the time, I think we can speak of challenges due to COVID-19 and crisis for hours. I think we have all lived it and we have all seen it and we have all experienced it or heard of experiences from it. But I think we need to be very focused on what women and children and youth and queer youth have been suffering through this time. And I think as much as I would have wanted to speak about it for hours. I think how the violence and gender violence has increased within our homes and within I don't know, intentional aspects of gender violence from our homes, from domestic violence, from incredible labor, from many hours of work within our homes on unpaid work and domestic work and whatever that has involved. And I think that's part of what we're facing constantly, and how it's it's not parallel for women and men, and how their homes have worked and have focused within this. And from my experience from working from a distance and from taking classes from a distance, it's not fair, and it's unjust, and it's not equal, and it's not equal opportunities when we have people to take care of at home, when we have to cook all the time, when we have to clean all the time, when we have to do many other things that are it's not possible for me to focus 100% on school and 100% on my job or whatever I'm doing from a distance, if I have to work for my kids and I have to take care of my kids all the time. Right now, women are becoming mothers and teachers and cleaners and everything and all of the above, and at the same time, and we're expected to work with everything at the same time.
Exactly. Good. A question from our audience. They would love to know how organizations have managed to engage with people in community who are afraid to ask for help due to legality in the countries. Have you guys had any insight into that?
I can try and respond to that. So, as COVID is unfolding, the kind of issues that people in the community are facing are also changing. So the first point was that people really had to understand what COVID is, what social distancing is. So that was the first one, which was kind of easier to engage with, because it meant that you caught hold of key influencers, you gave messages about social distancing, etc. But as the lockdown happened in many countries, and when people started losing their livelihood and jobs, it became more and more difficult to engage. So a lot of organizations who work in the community then kind of shifted focus to immediate relief, food, care, and now it's kind of shifting to kind of rebooting livelihoods. But I think the best way many of us have engaged with people in the community is really being present in the community, to tell people, give them the correct information. I think a lot of us have been talking about fake information, but how do you get the correct information, not just about COVID or COVID prevention or quarantine centers, but also about what are your entitlements. I know that in India, for example, the government has announced many relief measures, and you need to take this information to people for them to actually access it. So I think being there on the ground, being in a position to hear from people, being in a position to talk to people has been very important.
Now, how would you bridge the gap so that there's equitable access to information, education, technology? There's such a digital divide.
Maya, do you want to take that, or should I?
Whichever, no mind.
You go ahead and I'll join. I'll add. Yeah.
I think we during this process we have really seen a difference between what are privileged and what we have access to and what we have not. And many times we assume that everybody has access to everything. I mean, here in Puerto Rico, many of us have faced with the consequences that we have blackouts all the time. And that's even for me. And yesterday I had a blackout all day. And that's for me, that I have access to internet and I have access to many areas that many people don't. And I think I read a question that from what is a challenge for young people, mostly adolescents, and accessing information. And I think that's part of it. And I think that's part of how I mentioned before, we create communities and we create other families outside from our blood relatives. And right now we don't have access to that. And we don't have at least direct access to that. And we don't all have, we're not all on the same page on what we can and what we can't do. And I think that's part of it, that's important on how we're related and how we relate with each other. Not being able to be with us and not being able to speak, or not being able to have an outline or have a safe space or somewhere to break free outside from our families.
Do you feel that adolescents are taking advantage and getting creative with hotlines such as Facebook groups, WhatsApp groups, and how do we ensure that adolescents or everyone are using those tools to make the correct decisions, get the correct information?
Yeah. See, I think in many countries, not in all, the digital divide is huge. So we have to understand that there are people who may have phones, but these are not smartphones. They may have phones, but they do not have access to Facebook. They may have access to WhatsApp. So I think it's really important to work and strategize locally. So we work with young people who do not have 100% access. So we are translating our messages into very, very simple voiceovers and slides, and we are sending it through WhatsApp, right? So it's kind of, you can hear it, but you can just see some text on the screen. So I think every context will have to look at what is the kind of level of digital enablement in that locality, in that community, and then really kind of curate accordingly. So one size fits all is not going to work in this situation. And I think adding to what Maya was talking about young people and what they're undergoing, I think the closure of schools is really affecting, because in many poorer settings, young people also get their food in schools, right? So midday meals. So it's not just your nutrition, it's your kind of your peer network, it's your way that you get out of home, you go to school, you learn. So that's having, kind of increasing stress and having mental health impact. And I also think that, all of us have talked about, intra-household stress and violence, and adolescent girls are facing the brunt of it. And then, of course, because you're in a closed environment, you can't really fully exercise even your right to call for help.
Wonderful. So Maya, what is an emergent challenge for young people, mostly adolescents, in accessing information and entertainment during this pandemic that you've seen outside of some of the things already mentioned?
I think what in Puerto Rico we have seen in lots of countries in Latin America and the Western Hemisphere is that I think we can't group everyone in just one type of aspect. We can't just say that adolescents or young people or women or like a very essentialist general idea of what it is. We can't just group it, particularly in this sense and in this moment in time. I think we as hard as it may seem, we have to take it case by case or community by community or any aspect that we can actually make a difference, because I can say here that we miss our surroundings, and we miss our communities, and we miss our families, our picked families. But many, that's from my perspective and that's from what I have seen, but I also have seen many people who don't have access to anything technological other than maybe picking up a phone and calling somebody. We don't not necessarily have access to social media on a regular basis, or not necessarily have access to other areas that have been useful and have been proven to be useful to communicate and to feel a little bit more of that entertainment or that personal atmosphere. So I think we that's part of what we have to have in mind, that not everybody is the same, and that we can't just generate and generalize everything that we have within our spectrums and within our communities and our countries and our areas of work.
Yes, so the digital divide is definitely a factor, and we definitely cannot group people, adolescents and women, as you have said. So can you give us some examples of safe spaces where adolescents and vulnerable groups can raise their voices? I know it won't be the same in every community, but what have you seen, either of you?
What I have seen, we have here diverse ONGs that have worked together in many areas of crisis, not only COVID, but other areas that have worked within, and they have created and we have created diverse areas to, as we can, bring people in or go to communities and work with outreach programs and work with programs. Everything will modified right now, fewer people and diverse areas and everything because of COVID-19. But I think it's important to keep that personal matter and that personal aspect vivid, and to be able to communicate with people even if we are a 6 foot distance. right now there's a couple of support groups that have been going on from my organization that are it's part of IPPF, that has been going on from a distance as well, from people who have access and those who have not have access. We have gathered in public spaces, I don't know, 5-6 people to be able to speak and see each other and get a different sense of communication. Very limited time, very few access, but I think it's important to keep it personal, to not just get involved within only talking to a computer all the time or not being able to speak with anybody all the time. So I think that's part of important and to consider what we're doing.
Apu, do you have anything to add to that?
Yes, I just wanted to add that even simple but very useful things like helplines. So many young people, children do not know that there is a helpline they can call. So even if we start by ensuring that the numbers are advertised, people know that if they call this number, they will get help. I think even doing simple things at local levels will go a long way. But I also think that, having peer networks, yes, you have offline communities of young people, online communities of young people, but it's also important for programs on the ground to have groups of adolescent girls and boys who get together, who talk to each other. I know that from our own experience on the ground, when girls have come and said, it's kind of economy is bad now, so my parents may marry me off because the marriage is not going to cost too much. So, you talk to young people and someone said, oh, go tell them it's illegal to get married before 18, or, you can talk to your teacher. So I think, how do we build some of this offline kind of solidarity platforms and peer networks? The last thing I want to say is that families must talk of this within themselves. Young people their safest space needs to be in the family. So family also in times like this must talk of mental health issues, must talk of sexual health, etc., so that young people feel safe in their own homes.
Wonderful, wonderful. And one final question. What are some innovative ways to get to directly to the decision makers and people who have information? How do we get to them in order to ensure that the right decisions are being made, the right information is being put out there?
Should I go first, Maya?
Yeah, go ahead and go.
Okay. So I think the first step is really to learn about the lived realities, hear the voices. I think half the time we kind of speak for others, but I think it's difficult, but it's really important that first you hear about the issues. And then you really have to look at the channels for communication. So a group of, CSOs, standing somewhere, people may not listen to them, but you have key influencers in your communities, not just the media. You have your members of parliament, you have, other leaders, you have religious leaders, you have local governance leaders. So you have to really kind of work with them so that they can carry these voices to the powers that be. So we really have to be mindful of who are these kind of intermediaries who can help carry these voices from the ground right to the top to make a policy or a program impact. And the What Women Want campaign that I briefly referred to is trying to do exactly that. Maya?
Yeah, I agree. We have to, I think, change it up a bit and stop speaking so theoretically and stop speaking in terms of what could happen or what should happen or what has happened in the past, and actually speak of people who are living it and speak with people and about people and people who are living it, speak out and to be able to manage that areas and actually speak from experience, to know that I am living this, that this is what I'm going through. This is not just something that is supposed to happen or that could happen with a crisis scenario. This is what is actually happening to me. So this is what you have to take action on.
Thank you both so very much for this opportunity to speak with you and hear your thoughts around this topic. For our participants, we will be going back to the main plenary room. I've in the chat box, I have put the website, but it is the same website that you started in on this morning. So thank you again, once again, for joining us.
Thank you.
Bye.